Health Secretary Matt Hancock has announced that the police, firefighters, prison staff, essential staff of local authorities, the judiciary and Ministry of Labour and Pensions staff who need them will. He said, "Now that we have the curve under control, I want to be able to go back to the position that we can test everyone with symptoms, and I anticipate being able to do it fairly quickly because we I can now give you the full numbers from yesterday. Number 8,211. At noon yesterday, we had 18,665 tests in the past 24 hours, 16,166 in the first pillar, 2,323 in the second pillar and 176 in the fourth bill. So I know the history of testing is going to be a long debate. What really matters is what we are going to do from now on. And what I can tell you is that today we are able to expand eligibility for tests that are currently for patients, for surveys and for the NHS and social care staff, and some who go to LRF for urgent. Today I can expand test eligibility to the police, firefighters, prison staff, essential staff of local authorities, court staff and the DWP who need it, and we are able to do so because intensified T. Hancock told the Commission that the government had considered a London-specific lockout before applying the measures nationwide. We have considered a specific foreclosure in London and have decided it is best to do it across the country, said the Secretary of Health. And it is for two reasons. The first is that if you block part of the country, there is still travel from there to the rest of the country, so it's not that easy. And the second reason is that in fact one of the really strong things that came out of this crisis is that the country is acting tightly. He said the country came together in response to measures of social distancing. The separation of one part of the country from the others actually has drawbacks in terms of national unity that we have seen in favor of the overall response, he added.